Hi, I am Dr. Rajendra Gujjalnavar, Senior Consultant and Head of a Department of Plastic Surgery at Sakra World Hospital. September month is celebrated as a Craniosynostosis Awareness Month. And what is this craniosynostosis? It is a condition where there is a early fusion of the skull sutures than the normal, resulting in various abnormal head shapes. It affects 1 in 2500 childbirths, and it's very important to diagnose early and take a treatment early so that we can prevent a lot of effects of this condition on the brain and the child. How to identify? So usually parents can keep seeing a shape of the skull, I mean the child's skull. So if they find anything different in the shape than the normal, like normally it is a round shape. If they see a patient's head something like a triangle like this, so that is a sign that there is a chance of a craniosynostosis. Also, the skull is shorter, that the skull is shorter than the normal, or heighter, height is more than the normal. Even that is also one of the sign where you have to consult a doctor. Also, a skull which is longer than the normal, longer like this, from the front to back side, quite longer, along with there is a boxing in the front and the boxing in the back side. This is also one of the sign of a craniosynostosis. Also, normally we can feel the gaps when the parent put a finger across the skull. They can feel the gaps on the skull. If they don't feel that gaps, especially on the front, that is also one of the sign of the craniosynostosis. Also, along with that, if they find any changes in the face or on the forehead, that also one of the sign where they suspect something like craniosynostosis. When they see these condition, they have to consult their pediatrician or a craniofacial or a plastic surgeon so that they can evaluate completely and come to a diagnosis. And other very important thing is these are a condition which are treatable. If we diagnose it early, we can treat it with a minimally invasive surgeries with a faster recovery and minimal damage to the patient. If a patient presents at a later date also, still we can correct and we can make it a normal shape of the head and a normal growth of the brain, so that child can grow normally without any effect on the brain and a brain development at a later date. Thank you.